Hey, this is Bill again from Action Hero Fitness, where we transform lives by transforming bodies. This could be a very important video for you. I hope you pay attention. I want you to imagine a scenario where you maybe have daily back pain or knee pain or hip pain, and your doctor said to you, you might need surgery, you might need a hip replacement, you might need a knee replacement. And so now you have two choices I'm going to lay out to you. Choice one is to have the surgery, and the bill might be maybe about 150, 200,000, maybe up to 300,000, depending. They'll put an artificial knee or hip or something inside you. There'll be extensive surgery with anesthesia, and then there'll be when you're done, having to get back to normal, kind of a physical therapy period for, I don't know, 4 or 5 months, whatever. And then you go back to work. But the point is, the original muscle imbalances or misalignments that caused the problem in the first place won't be fixed at all. For example, if you have tight hips or you're tighter on one side and that's what caused your knee problems, none of that gets fixed. Everything's the same. So maybe in a year or two, you might have a new surgery or a new body part breakdown. So that's choice A. Choice B, you could go to a posture therapist or physical therapist or some of the things we do and get a routine to get your body back in balance and properly aligned and get out of pain. And the cost might be, I don't know, 3,000, 4,000 for 6 months, and you're pain free and don't need surgery at all. So my question is, which one would you pick? Now, surprisingly, it's, among the people I run into, most people actually choose option A, the surgery. Why? I can't tell you why. Maybe they think it just can't be that simple. I mean, you tell them you're misaligned, that you're leaning on one side or you're hunched forward, and that's what's causing your problems. And I think it just can't be that simple. They look at the choice A with the hospitals and the literature that looks nice and the nurses and the buildings, and it just seems more official and more authentic. So now don't get me wrong, sometimes it is necessary to have surgery, like perhaps if you herniate a disc and now you have numbness in your leg or something that's serious. And most of these doctors really do a good job with the surgery. They're very skilled. But the question is, was it necessary in the first place? I run into people in my job of fixing posture where they tell me they've had hips replaced. They said, wow, you must have really been in pain. And I say, no, I didn't have pain. It's just the doctor told me I had to get hips replaced. So I want you to maybe consider before you have that surgery, at least investigate whether a posture therapist or someone that does corrective exercise, might be an answer for you and might be able to have you avoid surgery. After all, as I said before, your car is not really like a car where you just swap out parts, take out the old hip, plunk in the new hip like a Lego set, and you're good to go. No, the surgery is a long, involved thing. There's always a risk. There's a very long rehabilitation period, and not to mention the expense. So, something to think about. I'm going to leave in the description some ideas for you and maybe a way to contact us if you'd like to discuss it more and maybe go get on a phone call and see our thoughts on the matter. But I really think you should at least investigate having a more conservative, slow approach. We kind of live in an instant gratification culture where you want to get rid of the pain right away and you want the new hip right away. And it does take more time to work on your muscles and get it back realigned and fix your back posture. But I think it's worth it, especially if you do want to avoid surgery and avoid all that goes with it. So once again, thank you for watching this video. I'll leave the information in the comments and description, and subscribe if you'd like more of the same. Thank you. Talk to you soon.